Let's say you've had an eye exam and your doctor tells you that you do not have glaucoma, or maybe you're a glaucoma suspect, or perhaps you've already been diagnosed with glaucoma. One of the biggest questions patients ask next is, how often do I need to follow up? And many also wonder, is there anything I can monitor at home between visits? Let's walk through what you need to know. Hi, I'm Dr. Constance Okeke, your host. I often get asked, how often should I be screened for glaucoma, and is there a simple test I can do at home? This is a very important question because glaucoma is a lifelong condition that often requires monitoring over time. The frequency of follow-up depends on what your doctor finds during your exam. Let's break this into 3 common scenarios. Scenario 1, no glaucoma found. If your eye exam shows no glaucoma and no major risk factors, routine screening is still important because glaucoma can develop slowly over time. General screening recommendations often include adults under 40 every 5 to 10 years, ages 40 to 54 every 2 to 4 years, ages 55 to 64 every 1 to 3 years, ages 65 and older every 1 to 2 years. These visits help detect glaucoma early, often before symptoms develop. Scenario 2, glaucoma suspect or higher risk. If your doctor says you are a glaucoma suspect, it means there are signs that raise concern, such as higher eye pressure, suspicious optic nerve appearance, or family history, but not enough evidence to confirm glaucoma. In this situation, follow-up becomes more frequent. Your doctor may recommend visits every 6 to 12 months, or sooner depending on your individual risk. The goal is careful monitoring to detect early changes before permanent vision loss occurs. Scenario 3, confirmed glaucoma diagnosis. If you have been confirmed with a diagnosis of glaucoma, follow-up becomes an ongoing part of protecting your vision. Monitoring frequency depends on the stage of glaucoma, how stable your condition is, and how well treatment is working. Some patients may need visits every 3 to 6 months, while others with more advanced or unstable glaucoma may need closer follow-up. Testing, such as visual fields and imaging, are repeated regularly to track progression and guide treatment decisions. Now, many patients ask, is there anything they can do at home to stay aware of their vision between visits? While there is no home test that replaces a professional glaucoma exam, there is a simple awareness test I often recommend. I call this the cover your eyes so you can see test. When both eyes are open, your brain blends the vision from each eye. If one eye develops vision loss, the other eye sometimes can compensate, allowing the problem to go unnoticed. I have seen many patients who had significant vision loss in one eye and didn't realize it until they were asked to check each eye separately. Here's how to perform this simple awareness check. First, wear your glasses or contact lenses if you normally use them. Cover one eye and look straight ahead. Pay attention to how clearly you see, both in the center and off to the sides. Then, switch and cover the other eye. Compare how each eye sees. Ask yourself, does one eye appear blurrier, dimmer, or missing areas of vision? If you notice a significant difference between the 2 eyes, you should contact your eye care provider promptly. It is very important to understand that this is not a test for glaucoma specifically. Many eye conditions can cause vision differences. Also, a normal result does not mean glaucoma is not present. Only a comprehensive eye exam can determine that. Think of this test as a simple awareness tool, not a replacement for regular eye care. The best way to protect your vision is to combine regular professional screening with personal awareness. Following your doctor's recommended follow-up schedule and paying attention to changes in your vision gives you the strongest defense against glaucoma progression. Now that we've talked about screening frequency and home awareness, you might be wondering what happens if glaucoma is actually diagnosed. In our next video in the Glaucoma Patient Journey series, we'll answer the question, what is glaucoma? See you there.